Hello, everyone. Thank you for joining me for the RNA viruses. Okay, these can get a little complex. I understand. Without further ado, let's get started. Let me go ahead and throw this in, just in case I forget. I don't think I'd forget, though, do you? I don't think so, but oh well. Let's throw it in because I could. I might get carried away now. We're getting into some pretty fun stuff. Okay, $3. Go to joeyjohnsondo.com. Click on the donation tab. You will click then on the PayPal link and donate $3. One time only, please. I would greatly appreciate it. All right, now, one thing we will not be doing is delineating viruses into arboviruses. You'll see some people do that. Okay, I kind of hate doing that because you're starting to mix up then all your helicals and your icosahedrals. All right, all that arboviruses means, okay, it does not mean tree, okay, first of all, so get that out of your head. It does not mean a little pretty green tree or something, they live in a tree. No, arboviruses is a combination of the words arthropod and born, okay? You have the R from arthropod, B-O-R from born. It just means that they're transmitted by vectors, okay? I did a lecture on vectors, so you watch that, you'll have all of them, all right? And if you want a mnemonic to kind of remember what groups they come from, the families, you got fleas, ticks, and bugs, okay? The F for flaviviruses, T for togaviridae, B for bunyaviridae, okay? There's only one other, and it's going to come from reoviridae. We'll go over that here in just a second. But those are your arboviruses, so we will not be doing a separate group of arboviruses because you'll know them already, okay? So now, when we talk about RNA viruses, the thing you want to do is break them up into whether they're icosahedral or helical, because what that will then do is give you 4 groups, and that will be all of your RNA viruses, okay? Break them up into icosahedral, envelope versus non-envelope. And so that's why I put a box around this to separate it out for you, okay? And so then I'll give you your first group and your second group of icosahedrals, all right? Then you're going to go to helicals and break them up whether they're segmented or non-segmented. Then that'll give you your first and second groups of that, okay? And so if you do that, you will have 4 groups, and that will be all of your RNA viruses. All right, then we'll have a mnemonic to help you out for which ones are positive sense. There's only 6 of them versus the negative sense ones. All the rest of them will be. Which ones are linear versus circular? Only 4 of them are going to be circular. And remember me telling you, omas be bad, right? And if y'all remember, then that's going to be for HDV. This is going to be HBV. All right, that's going to be bunyaviridae. That's going to be arenoviridae. And we'll have the small letter delta around the HDV here after a while. I think that'll be on the next lecture, actually, to remember it's circular. You will have the circular cojones, if you remember, right here for HBV. And then think of a bunion. A bunion's kind of round and circular. Think of arena, like a round arena, like the Colosseum. It's round and circular. And then omas, that's going to be from the Papoviridae. Remember your polyoma and your papilloma. And of course, just think oma, like a tumor or something like that, being round or circular, okay? And so then you're going to talk about the double-stranded versus single-stranded. There's only one double-stranded. We'll hit that here in a minute. So without further ado, oh, there is one more thing I wanted to touch on, adenovirus. Remember I said I put the A or the D and A in here very big, so that way you would know not to get it confused with rhinovirus for your almost be bad mnemonic. But the thing about adenovirus, we forgot to talk about a couple of things. Airway infections, you have coryza, cough. It can be febrile or cause pharyngitis. Diarrhea, okay, it's going to be one of your ones that can cause the runny diarrhea. Remember, ran to the restroom. Okay, you got your Norwalk virus. You have your adenovirus, and you have your rhinovirus that can cause the diarrhea, watery diarrhea from this, okay? It can cause eye infections. Conjunctivitis is a huge thing for adenovirus, okay? And then you can get this from non-chlorinated pools and also overt urinary bleeding. Now, the reason I put differential diagnosis here is I want you to be aware when we get to morbilliform virus, which is going to be measles, also known as rubeola, okay? It's going to have these 3 C's as a prodrome. And I want you to be able to know that even though it's going to be a prodrome with these 3 C's in it for morbilliform virus, if it comes first, then a rash comes later, you're thinking measles. But if you see these 3 things, it could also be adenovirus. So even though these are kind of pathognomonic, okay, that's the 3 C's for measles, you could see that with adenovirus as well. Also have a differential diagnosis in mind if you see overt urinary bleeding, because you might have the drug cyclophosphamide involved, or it could be the BK virus, all right? Remember, that's going to be a DNA virus also. Junkie cerebrum is your JC virus. The BK virus is bad kidney. All right, and remember adenovirus is a DNA virus, okay? Just wanted to touch on those. So now let's get started on these. Okay, so we have the one double-stranded RNA virus right here, which is reoviridae, all right? And if you notice, I tried to draw something there to kind of help you remember this, and it's kind of odd. So let's go over it first. Okay, we have a river here for Rio, and it's segmented, all right, because it's the only segmented, all right, RNA virus. And rotavirus, so we have the two circular wheels here. They're kind of rotatory, and you have the cult there for cultivirus, all right. And so let's go ahead and kind of talk about this. So rotavirus, all right, it is the most common watery diarrhea in kids. All right. Also, and in your RAN mnemonic that I gave you, if you remember, I said that's going to be rhinovirus. Yes, rhinovirus can cause it. Also, remember rotavirus. So let's go ahead and throw two in there, okay? Rhino and rotavirus for the R part. So this is the most common cause of watery diarrhea in kids. You'll get this in daycares. So if kids end up coming home with diarrhea, they're in daycare, you're thinking Shigella or rotavirus. How do you differentiate? Remember, Shigella can cause bloody diarrhea. This does not. This causes watery diarrhea. It is transmitted to fecal-oral route. It's the top cause of fatal diarrhea in kids. It causes impaired absorption. Just think of those wheels getting in there and really jacking up some villi and tearing it up. Okay, so you're not going to get electrolytes. You're going to have nausea and vomiting, infantile gastroenteritis. You're going to give them rehydration, and there is Rototec, which is a vaccine against it. It is oral, and it's a live vaccine. All right, now cultivirus is going to be, like I said, the only one that's not in your fleas, ticks, bugs group. All right, it's right here in the Rio Viridae, and so it is endemic to Rocky Mountain areas. There's really no treatment for it. The virus can get in and infect your bone marrow. So basically how it happens is there's rodents that are carriers. The wood tick will bite the rodents, and then it will come over and bite you. And then you have headache, you have ocular pain, CS2 eyes right there, like bugging out, like, okay, because it causes massive ocular pain. All right, and so it causes myalgia and also fever. Okay, so just imagine it's kind of red too because he's got a fever. So that's going to be over there in your Rio Viridae. All right, so now let's get down here to these non-segmented ones. All right, Picornaviridae. The way you can remember that is the mnemonic perch. Okay, you have polio, echovirus down there, rhinovirus. You're going to have Coxsackie virus, and you have hepatitis A. Okay, so P for picorna and perch. And notice the two little corns out there, right? All right, so let's talk about polio, the P in perch, okay? So it damages and lyses motor neurons in the spinal cord. It can also cause aseptic meningitis. If you remember that there is some vaccines for it, you have the Sabin, which is the live form, and you also are going to have the Salk form, and the K is for killed, I said, to help you remember that. There's, attenuated. And so echovirus, let's go to it now. It's fecal oral route transmission. It can cause aseptic meningitis as well. And if you want to remember the ones that can cause aseptic meningitis, you can remember the mnemonic amped up, kind of like you have to amp up your diagnostic skills if you're dealing with aseptic meningitis, okay? So that's going to be for Coxsackie A right there. You're going to have mumps, you're going to have polio, and you're going to have echovirus, okay? The D is not anything. I just put it in there for the mnemonic. So that's what's going to cause your aseptic meningitis. Coxsackie A, mumps, polio, echoviruses. Most common causes of them anyway for viruses. All right, so now let's go on to rhinovirus. Rhinovirus is going to be it is the most common cause of the common cold, okay? You can remember RCA for that, rhinovirus, coronavirus, and adenovirus, all right? And if you want to, you can remember CAR as well, okay, to kind of get them in there, but RCA will kind of get them in the order of the most commons, okay? This is going to cause about half of all your colds. How convenient. It's nose in our little mnemonic, and we're going to talk about that mnemonic here in a second as well. Also, it can come in there, and it's going to bind to your ICAMs and your upper respiratory tract, so you can kind of think of a rhino. I don't know how to draw a rhino. There he is. Roar, okay? And I is right there for his little rhinoceros horn, okay? So, because it binds to ICAM there. Let's see, anything else about it? Let's see, we said common colds. Like I said, just remember that mnemonic for RCA. Remember, Coxsackie can also be a cause of common cold-like symptoms. We'll talk about that here in a minute. You're going to give supportive care for that. And, of course, it's spread by not hand washing and aerosol droplets. So let's go on to Coxsackie A now. You're going to have high incidences of that in the summer and in the fall. It's fecal oral route transmission. You have Coxsackie A and Coxsackie B. Coxsackie A is going to cause the herp anginas, which is going to be the mouth sores and hand, foot, and mouth disease. Remember now, if you see some palms come in and somebody has palms or the soles of their feet, all right, and they've got like a rash around it, you're only going to think three things, right? You're going to think CART, all right, for Coxsackie A, rickettsia, which is Rocky Mountain spotted fever, or T for Treponema pallidum. Some people will they prefer the mnemonic cars instead, which is fine as well. Okay, if you want to go with cars, that's fine. So you have Coxsackie A, you have rickettsia, and you have S for syphilis. But if you see rash on the palm of the hands or soles of the feet, you're thinking those three. Okay, so Coxsackie B now, it can cause the heart stuff, the endocarditis, the pericarditis, the myocarditis. So you're basically going to treat it symptomatically. All right, and that is it on that. Let's go to HAV now, okay? And so HAV, if you remember, there are several different forms of hepatitis. All right, you've got your HAV, you've got your HBV, your CV, your DV, and your EV. What I want you to remember is if it has a vowel, it can come from a vowel, okay? So your HAV and HEV, they are fecal oral transmission, the rest are not. Also, these that are consonants, okay, they are consonants, so they have a C in them for consonants, right? They're the ones that can cause your chronic forms, all right? So HAV, back to it, is fecal oral transmission, like I said. It can cause acute hepatitis and jaundice and hepatomegaly, but there's no chronic state, so you don't have to worry about cirrhosis or hepatocellular carcinoma. Look at all those C's in there for chronic, right? Consonant ones, hepatocellular carcinoma, cirrhosis, chronic state, okay, all those were the consonants. We're in the vowel world, so we're talking about the ones that comes from the vowel, okay? Remember the deadened form attenuated virus vaccinations? HAV is in your RIPA right there. Go back and look at that lecture if you don't remember those. You see IgG is going to indicate a past infection. IgM, you're detecting it in the serum. Okay, that's it on that. So now let's talk about this other little mnemonic I have here to help you remember. So we said picorna is for the purchase, right? Rhino, you should remember that for nose, and ICAM, okay? It causes rhinorrhea, of course. Like I said, common cold and all. You get the runny nose, common cold symptoms. All right, and when we think of these, we think of Kalichi viruses is coming out the butt, right? What come out your butt? Fecal oral transmission, also diarrhea from Norwalk virus, and then road, because the cultivirus, so you can remember gut, nose, butt, road, okay? So just think about it. If you get these viruses, the non-enveloped icosahedrals, okay, you can get sick in the gut, you can throw up, it comes out your nose, it can come out of your butt through diarrhea, and you rode a colt, okay? So you rode a colt, and you started getting sick from these viruses or something. I don't know. Have fun with it. Put it together. Gut, nose, butt, road, okay? All right, so what I want to go ahead and do is talk about these RNA enveloped icosahedrals, get you introduced to those and how we wrote those up. All right, so as we come down the list here, we've got Delta virus. You notice the little circular lowercase delta. I told you it was coming, so it's not the uppercase delta, it's the lowercase delta. To remember that it's circular. It's one of your circular ones. All right, you should know who that is, okay? If you don't, sorry, it's Marilyn Monroe. All right, it's retro stuff. You're going to a retro party, as you'll see in our positive sense mnemonic when we get to that later. But it's an LV, okay, out in Las Vegas. So it's getting hot out in Las Vegas, but don't get HIV. All right, at the retro party. So hot in Las Vegas, don't get HIV. That'll remember which ones are your retro viruses. All right, and so yeah, that's it on that. So we got Flava Flav here. He's always hitting on girls. He's like, dang, you fine. Flava Flav. See the Flava Viridae right there? Ah, you like that, don't you? Okay. And so some people think of them as kind of sleazy. So it's SLE to remember St. Louis encephalitis. And of course, we're going to go over these in detail next lecture. I'm just introducing you to them now because I've got time. I like to keep these things under 15 minutes, but I'm going to use it all for what it's worth, right? All right. So he's got his gold teeth going on here. Yellow fever. All right, then we got Tupac down here. Instead of West Side, he's like West Nile. All right, and notice the little juicy juice he's drinking on. All right, so the juice is going to be high in vitamin C. Remember, like spiked orange juice, right? So he's got him some spiked orange juice. This ain't the South. He's over in the West Side, right? Like in the South, we'd be rapping about some scissor, right? We'd have some folks talking about, sipping on some scissor, but we're not there. We're out in the West. West Nile, drinking on that juice, right? Okay. And dang, you fine little sleazy Flava Flav with the yellow teeth. Now, I am a child of the 90s, folks, so I have to tell you, if you don't know what this is, bless you, right? I'm a Georgia boy. I'm going to say bless you, right? You don't know what that is? Sorry. I'm not going to tell you now. Anyway, so I'll tell you, it's a treasure trove with ruby red hair for rubella. He's wearing a toga verde, toga, okay? So, dang, you fine. West Nile? And oh yeah. Told you guys, I probably wouldn't forget. Go to Joey Johnson D joeyjohnsondo.com, joeyjohnsondo.com. Donate your $3 one time only if you have not by now, please. Thank you.